My name is Donna, and I'm a crisis interventionist here at Lloydminster Sexual Assault Services. Today I'm going to talk to you a little bit about depression and anxiety. Everyone feels depressed or anxious from time to time. You are not alone. This is completely normal. And it's okay to reach out and talk to someone about your feelings of depression or anxiety. The good news is that there are some things we can do to help ourselves when we have these big feelings. Depression is the most common, and most often those with depression also experience anxiety. So let's talk about depression first. While we all feel depressed from time to time, that doesn't mean that we have depression. When our feelings of depression become worse or are not going away, or when our feelings of depression begin to stop us from doing the things that we normally would do, or when they happen every day or last more than 2 weeks, we may have depression. We can be on the lookout for depression by knowing some of the common symptoms. We might have trouble sleeping, feeling tired all of the time. We might get sick easier, or have low energy. Our headaches might increase. We might have muscle tension. We might have stomach problems. We also might begin to avoid places or people. We might have difficulty making decisions, or increased substance use. Sometimes we might feel hopeless, or have a lot more irritable feelings. Some strategies that you can try if you think you are dealing with depression are first to talk with your doctor or healthcare provider. They can help us make sure that the issue is not medical. They can give us a referral to get services with a mental health agency. Sometimes medication might be prescribed. At home, you can try keeping a journal, writing down things that increase your feelings of depression and things that make you feel good. You might want to try counseling to learn new ways to cope. Anxiety is also common. Anxiety is feeling worried or nervous. And everyone feels worried or nervous sometimes, like when we're starting a new job or going to a new class. When our anxiety lasts a really long time, like weeks or months, and is impacting our everyday life, we may need to get some support. Anxiety affects people differently. For example, some people will have sudden attacks with no warning at all, and others feel anxiety when being in a crowd, and still others might worry all of the time. Some symptoms include trouble concentrating, racing thoughts, memory issues, tight chest, dizziness, maybe tense muscles and upset stomach. We might begin to avoid people or places. We might fidget more often, and we might have increased substance use. Some strategies you can try for anxiety is we can reach out to our doctor or healthcare provider. They might prescribe medication for us, and they may give us a referral for supports like counseling. We can try journaling, tracking our triggers, or using mindfulness practices such as deep breathing or yoga. If you are experiencing depression, anxiety, or both, you could access support by calling 811. Thank you for watching, and remember, you are not alone. Take care.